Good afternoon. My name is Samantha Kranz, and I'm going to demonstrate how using strategic planning can improve the discharge process. The strategic planning process includes a SWOT analysis, review of the mission and values of the hospital, and creation of a strategic goal that both aligns with the mission and stems from the SWOT analysis. Creation of a strategy map, action plan, communication plan, and evaluation process is also included. The SWOT analysis was the starting point for the planning process. Key points in the SWOT analysis include a major strength of dedicated employees that strive for providing optimal patient care. Weaknesses include poor communication between staff and other departments regarding the discharge plan, loss of revenue due to delayed discharge process, average discharge time of late in the day, nurses having been identified to delay the discharge process in order to prevent getting additional patients assigned. Opportunities include improved communication regarding the discharge process to other departments that can assist in the discharge process, improved staff education regarding the unit budget and how discharging patients early improves the budget, improved staff education of HCAHPS and how this impacts hospital reimbursement is also an opportunity. Opportunities to improve the budget by improving the discharge process are evident by the SWOT analysis. According to Community Hospital's website, Community Hospital's mission to provide the highest quality care is in the most cost-efficient manner, respecting dignity of the individual and providing for the well-being of the community and serving the needs of people, including the poor and disadvantaged. The mission statement demonstrates Community Hospital's dedication to providing quality care. Community Hospital's values include providing compassionate, high-quality care that meets the needs of the community with both stewardship and dignity. From reviewing the SWOT analysis as well as the mission and values for the organization, a strategic goal was formulated. The strategic goal is to move the average discharge time up by 60 minutes by the start of the next fiscal year in order to improve the unit budget. This strategic goal aligns with the mission by improving the quality of care and providing care in a cost-efficient manner. Currently, the hospital is often filled to capacity, which often results in the hospital going on bypass. The result in a significant loss of revenue. If patients were discharged earlier in the day, additional patients would be placed in these beds, which results in more room in the ER and less bypass hours. Community Hospital values high-quality care. This plan aims to improve quality care by improving the discharge process, by improving communication between healthcare team members. The next step is to brainstorm about the stakeholders in regards to the strategic plan. Stakeholders include upper administration, case managers, social workers, discharge team members, employees, patients and visitors, and members of the IT department. To focus the strategic planning process, a strategic map was created. The strategic map demonstrates how improved communication between nursing staff and medical staff result in an improved discharge process. This will then result in the patient being discharged earlier in the day and therefore a new patient being placed in the bed, which will bring in additional revenue. The map also demonstrates how educating nurses with the discharge process impacts how patient satisfaction as well as improves the budget. By improving the internal process of how discharge needs are displayed in the electronic medical record, communication can be improved between nurses and members of the discharge team. This will result in both the improved discharge process and improved method of communication. Collaboration between outside facilities to agree on earlier discharge times will also assist in early discharges. This will also lead to patients being more satisfied with the discharge process. Strategic action plan includes development of teams to implement the plan, creating an innovative communication tool developed by IT, educating the nursing staff, and creating a performance dashboard that will help keep the whole project on track. Communication plan includes face-to-face meetings, mandatory education. The innovative tool will be demonstrated through mini meetings that visit each unit and demonstrate the process to frontline staff. Leadership skills will need to be utilized to ensure all stakeholders remain focused on the strategic goal. Leaders will need to collaborate with stakeholders to gain insight and perspective regarding the discharge process. Leaders will need to hold stakeholders accountable. Evaluation includes an after-action review. This includes comparing average discharge times pre- and post-implementation. Patient survey results as well as staff survey results will be looked at for feedback. Continuous monitoring of discharge process will be reviewed on a quarterly basis. This proposal of strategically improving the discharge process will align with the unit goal of improving the budget as well as the hospital's mission to provide high-quality care that is cost-effective. Implementing this plan continues the hospital's values of providing high-quality care that meets the needs of the community. An improved discharge process helps to meet the needs of the community by having more available beds in the hospital. Thank you so much for your time.